Cranial nerve assessment is a method used to evaluate the function of the 12 cranial nerves in a patient. It assesses the body's response to sensory and motor functions and notes any ability or difficulty the patient has while performing the assessments, observing for abnormalities or deficits. The first cranial nerve assessment tests the patient's olfactory nerve. The olfactory nerve is a sensory nerve that allows us to smell and distinguish various scents we encounter daily. The patient must be blindfolded for the perfume test, which includes spraying the perfume and allowing the patient to smell the scent within a limit of 7 minutes. The patient identified the perfume scent within 1 minute and 42 seconds, indicating an intact result for this part of the test. In the spices guessing test, the patient is introduced to the smell of 4 spices: turmeric, cayenne, garlic flakes, and cumin. The patient correctly identified 3 out of the 4 spices, demonstrating that the cranial nerve 1 assessment remained intact. The second assessment, for cranial nerve 2, tests the patient's optic nerve, which is responsible for transmitting visual information and enabling sight. To test this, a pen light is used to observe the constriction or dilation of the pupils. If the pupils constrict when exposed to light, it indicates that they are reactive and the patient's cranial nerve 2 is intact. Both of the patient's pupils constricted when the light was shined into the eyes. The second part of the assessment involves having the patient guess numbers formed by the nurse's hands outside the patient's direct line of sight while they remained focused on looking straight ahead. The patient guessed all of the numbers correctly, indicating an intact cranial nerve 2. The third and final process tests the patient's focus and accommodation. A tape measure is placed at the corner of the eye, and the marked paper is moved slowly toward the patient until the eyes exhibit a crossed or double vision. The distance at which this occurs should be measured in centimeters. The patient's measurement was 14 centimeters. The third cranial nerve, the oculomotor nerve, controls eye movement, positioning, and focus. To test this, the patient is asked to follow a marker moving in different directions. The extraocular muscles facilitate eye movement, and this can be observed by following a pen or a marker. This nerve assessment involves 4 of the 6 extraocular muscles: the medial rectus, inferior rectus, superior rectus, and inferior oblique. The patient successfully followed the movements, indicating an intact result. The fourth cranial nerve is the trochlear nerve. The extraocular muscle test continues, focusing only on the superior oblique muscle.
The fifth cranial nerve is the trigeminal nerve, the largest of all 12 cranial nerves. To begin the assessment, the patient is blindfolded and instructed to identify materials based on the sense of touch. The first step involves determining whether the material is soft or hard by gently pressing it against the patient's face. The second step is to identify whether the ends of a pen are pointed or blunt by pressing them against the patient's arms. Lastly, the third step involves identifying whether the material is hot or cold. The patient correctly identifies all the materials, indicating that cranial nerve V is intact. The sixth cranial nerve is the abducens nerve. The final extraocular muscle test focuses solely on the lateral rectus muscle. The seventh cranial nerve is the facial nerve. This is primarily responsible for controlling the muscles of facial expression. To see if the patient's seventh cranial nerve was still intact, she was asked to blow or smile, close or open the eyes, close or open the mouth, and chew. We can see that it is still intact because she was able to do the following. The eighth cranial nerve is the vestibulocochlear nerve, which is responsible for transmitting auditory information for hearing and providing sensory input for balance and spatial orientation. To test this, we can conduct an assessment, especially through Weber's and Ryan's test. The first is the Weber's test, where we strike a tuning fork and place it on the middle top of the patient's head. The patient said that the sound is heard louder in her right ear. The second is the Ryan's test, where we strike a tuning fork and place it on the patient's air conduction near ear and bone conduction behind ear. The patient said that she can hear the sound much louder behind her ear on both right and left side. Which this result, it seems like the patient has conductive hearing loss on the right side of her ear, and the left side of her ear is her source of hearing. But to double check if the Weber's and Ryan's test results are correct, the patient was instructed to do an anatomical position, first with her eyes open in 1 minute. After that, the patient was instructed to close her eyes while we observe her for any swallowing. The Weber's and Ryan's test results are correct and accurate.
The ninth cranial nerve is a glossopharyngeal nerve. It provides sensory input for taste from the posterior one-third of the tongue. To test this, the patient was blindfolded and asked to taste different foods. The first step was to pat dry the patient's tongue and let her taste the first food, the raisins. She got it right. Before we proceed to the second food, we'll let her drink water to neutralize her taste buds. With the same step, which is to pat dry the patient's tongue before and to let her drink water after each food, we'll let her taste the second food, which is a banana, the third food, which is a cheese, and the last food, which is an apple. She got all the food right, meaning her ninth cranial is still intact. The 10th cranial nerve is the vagus nerve. This is essential for the gag reflex, working with the glossopharyngeal nerve to trigger a protective response when the back of the throat is stimulated. You can see that we insert it multiple times, but the patient is still not gagging or reacting. The result of this test shows that the patient's vagus nerve is already not intact. The 11th cranial nerve is the accessory nerve. This is crucial for motor control of the sternocleidomastoid and the trapezius muscles. To test this, the patient was asked to turn her neck to her right and left lateral and also to elevate her shoulder. She was able to do it, meaning that her accessory nerve is still intact. The 12th cranial nerve is the hypoglossal nerve. This is primarily responsible for controlling the muscles of the tongue. To test this, the patient was instructed to do several tongue movements. First is to move it to the right and left lateral. Second is to move it in and out. And lastly, to move it to superior and inferior. The result is intact. Additionally, we conduct a patella check where we do a quick tap on the patellar tendon to check the knee jerk reflex. It jerks or moves, meaning the patient's knee is intact or healthy.